Heart disease remains one of the leading causes of death worldwide, prompting experts to uncover its root causes and its prevention. Recent research has offered deeper insights into cardiovascular health, emphasizing that small lifestyle changes can have a massive impact on reducing the risk. From what you eat and how much you move to the quality of your sleep, every factor plays a role in maintaining heart health. In this video, we'll explore everything about heart diseases, including the real reason behind them. The foundation of most heart diseases lies in a condition known as atherosclerosis, where fatty deposits accumulate in arteries, hardening and narrowing them over time. This restricts blood flow to the heart and other organs, increasing the risk of heart attacks, strokes, and other cardiovascular complications. According to the American Heart Association (AHA), factors like high blood pressure, elevated cholesterol, smoking, diabetes, obesity, stress, and inactivity are key culprits. However, emerging studies highlight new perspectives and actionable measures that could change how we address heart disease. Diet plays a significant role in both preventing and contributing to heart disease. Research proves that what you consume directly affects your cholesterol, blood pressure, and inflammation levels. Foods rich in antioxidants, fiber, and healthy fats can combat heart disease, while poor dietary choices have the opposite effect. Dr. Andrew Freeman, a preventive cardiologist at National Jewish Health, emphasizes the power of a plant-based diet. He explains that foods like leafy greens, berries, and legumes are high in fiber, nitrates, and antioxidants, which combat inflammation, one of the leading drivers of atherosclerosis. A study published in the European Journal of Epidemiology found that regular consumption of nitrate-rich vegetables could lower the risk of cardiovascular disease by 15 to 20%. Berries, such as blueberries, strawberries, and blackberries, are packed with antioxidants like anthocyanins, which fight inflammation and oxidative stress, two factors closely linked to heart issues. A Harvard study found that individuals consuming 3 or more servings of berries weekly had a 34% lower risk of heart attacks. Whole grains, too, are recommended by experts such as Dr. Dariush Mosafarian, a cardiologist and professor at Tufts University. His research shows that fiber from whole grains like oats, quinoa, and brown rice helps lower LDL, bad cholesterol, and reduce plaque buildup. Research from Harvard T.H. Chan School of Public Health suggests that individuals who replace refined grains with whole grains lower their risk of coronary heart disease by nearly 20%. Similarly, legumes like beans, lentils, and chickpeas are loaded with fiber, protein, and potassium, which support healthy cholesterol and blood pressure levels. Healthy fats are essential for heart health, particularly omega-3 fatty acids. Fatty fish like salmon, sardines, and mackerel have proven benefits in reducing inflammation and lowering triglycerides. A meta-analysis published in the Journal of the American Medical Association found that individuals who consumed omega-3 rich foods experienced a significant reduction in their risk of cardiac events. The Mediterranean diet, a well-studied eating pattern, includes fish, olive oil, nuts, seeds, fruits, vegetables, and whole grains. This diet, along with the DASH, Dietary Approaches to Stop Hypertension diet, is particularly effective in improving heart health and reducing blood pressure. Conversely, processed and unhealthy foods can severely damage cardiovascular health. Dr. Kim Williams, a past president of the American College of Cardiology, warns that diets heavy in processed foods increase inflammation and blood pressure, leading to higher heart disease risks.
That diet had actually reversed her disease dramatically. So that made a believer out of me. It made me, look into Dean Ornish's diet more, realize that he had published this with Nuclear multiple times. And so the data's been out there for quite a while.
Saturated fats in red meat, butter, and full-fat dairy, trans fats in fast food and processed snacks, and added sugars lead to plaque buildup and inflammation. Excessive sodium intake, often found in packaged and restaurant foods, increases blood pressure, a major heart disease risk factor. The World Health Organization recommends limiting salt to 5 grams per day to reduce cardiovascular risks. Exercise remains a cornerstone in preventing heart disease. Physical activity keeps the heart strong, lowers blood pressure, improves cholesterol, and maintains a healthy weight. Dr. Chiadi Ndemele, a preventive cardiologist at Johns Hopkins, explains that regular exercise improves heart efficiency, lowers blood pressure, and boosts good cholesterol.
Additionally, obesity has a variable associations with various metabolic risk factors such as diabetes, high blood pressure, abnormal cholesterol, inflammation, and trying to understand why some individuals develop those metabolic risk factors and some do not.
The American Heart Association recommends at least 150 minutes of moderate aerobic exercise, or 75 minutes. Even small changes like brisk walking, cycling, swimming, or dancing can improve heart function. Before we continue, make sure to subscribe and hit the bell icon for more updates. Let's move on with our video. The study revealed that individuals who exercised regularly had a 75% lower risk of heart attack or cardiac-related death, even if they already had blocked arteries. For those unable to hit the gym, home-based exercises can be just as effective. Bodyweight movements like squats, lunges, push-ups, and jumping jacks increase the heart rate and burn calories. Even climbing stairs, yoga, and stretching routines improve circulation and reduce stress levels, further benefiting heart health. Sleep often takes a back seat in discussions about heart health, but its importance cannot be understated. Research consistently shows that poor sleep habits increase the risk of hypertension, heart attacks, and other cardiovascular issues. The National Sleep Foundation recommends that adults get 7 to 9 hours of quality sleep per night. Inadequate sleep disrupts hormonal regulation, leading to weight gain, stress, and elevated blood pressure, all precursors to heart disease. Establishing a consistent sleep routine, avoiding caffeine late in the day, and creating a restful bedroom environment can significantly improve sleep quality. Spotting the early signs of heart trouble can save lives. Chest discomfort, often described as tightness, pressure, or burning, is one of the most common symptoms. However, not all heart issues manifest in dramatic ways. Shortness of breath during daily activities, fatigue, dizziness, nausea, and irregular heartbeat could also indicate underlying problems. Johns Hopkins cardiologists emphasize that women in particular might experience subtle symptoms like jaw pain, back pain, or extreme fatigue instead of the classic chest pain during a heart attack. It's important to recognize these warning signs and seek medical advice promptly. Regular health screenings to check blood pressure, cholesterol, and blood sugar levels are crucial, especially for those with a family history of heart disease. Stress management is another often overlooked factor in heart health. Chronic stress triggers the release of cortisol, a hormone that raises blood pressure and inflammation levels. In response, people might turn to unhealthy coping mechanisms like overeating, smoking, or drinking, all of which contribute to heart disease. Techniques like mindfulness meditation, deep breathing exercises, and yoga have been shown to lower stress levels and improve heart health. A study in the Journal of Clinical Psychology found that individuals practicing mindfulness meditation experienced reduced blood pressure and heart rate over time. Moreover, staying socially connected and engaging in hobbies can alleviate stress and improve emotional well-being, contributing to a healthier heart. Loneliness and depression are associated with an increased risk of cardiovascular events, as supported by research published in the British Medical Journal. Advancements in research continue to shed light on the real causes of heart disease and ways to prevent it. While genetics and certain uncontrollable factors play a role in heart disease, much of its prevention lies within our control. Eating nutrient-rich foods, avoiding harmful dietary habits, exercising regularly, and prioritizing sleep can protect against heart disease. Doctors and researchers emphasize that small, consistent changes in lifestyle can significantly reduce the risk of heart disease and pave the way for a healthier, longer life.